guys, we're here at the Medcurity Sunday Social with some of the healthcare and cybersecurity leaders, and we are asking everybody what trend in healthcare they are interested in right now or is excited about right now. So we're excited to hear from everybody about what they're looking forward to in the future. What's a trend in healthcare right now that you are interested in or excited about?
I'm really excited about workforce and workforce development. And so really what that has to do with is our staffing. How do we build care teams and the frontline staff and even providers and to make the care teams that take care of our patients. So what we've found is that you need to be strong in both that clinical aspect and supporting your providers, but also having the people that can get your patients and schedule them, check them in, all of those things, and creating more than just a job for people, but also career pathways so they can start at an entry-level position and progress through your organization and become managers and other types of contributions. So when you come into an organization, you actually can end up somewhere completely different over the long term.
So I think right now the trend, the big one is AI, right? I think a lot of people some people are intimidated, some people don't understand what's coming next, and for us as an organization, as a partnership, we like to go out there and see the different technologies and how can we introduce some of the new technology out there to our partners to make sure that they're moving with the new technology.
What trend in healthcare right now are you interested in or excited about, something that you've been looking into a bit?
Definitely AI. Like at this conference, I'm going to a lot of different AI sessions, so it's piqued my interest for sure.
It's big, and there's a lot of different facets of that as well. We've gotten to hear a couple of them, but it's really cool. Yeah, how about you?
I hate to not differ from the AI, but definitely AI in healthcare, how it's integrated, especially with scripting, the AI scribe, and how it can be integrated in a safe, compliant way to protect the healthcare organizations.
I will tell you, it is so good to be in person. It is amazing how much we can share. The serendipity of what happens in these events has been incredible, and to have events like this is just wonderful. And we went without it for a couple of years. Bringing it back, people showing up to learn from each other, even in the age of AI, when we can learn so much. I think we learn even more being around each other, and what we're all learning on a fast pace, especially with AI, but around healthcare policy changes and everything else. So being in person is amazing.
I would say for both of us, it's artificial intelligence in healthcare.
How are you seeing that play out or evolve in your world?
So I think Bruce and I spent a couple of hours meeting with some senior leaders, and we believe that the speed of adoption should be accelerated.
That's awesome, thank you. And do you want to share on that too? Or another trend?
No, absolutely. That sounds great. I think with AI, we see there's incredible opportunities around patient engagement, around looking at drawing people in, optimizing our care. This is what we have to be dealing with. This is what we have to be addressing. So it was very exciting having these meetings in the last couple of days.
I don't know if I'm excited about this trend. However, I am finding that we're dealing with a lot of situations where there are barriers to healthcare for patients. And a big one would be cardiology referral changes, where here in Spokane we only have 2 locations to refer to, and that can cause issues for patients being able to find access to care. So really working on removing those barriers for patients.
Anything with the words AI in it. All of our clients want to know what's out there, what's the newest thing, what they should be looking at. So we are here to see what's the latest and greatest, so we can bring it to them to show them what they should be looking at.
I would say, so I'm a physical therapist also, and there's a lot of therapists that are getting burned out and want to use their degree in a different way. So just seeing different tools and automations that can help decrease the burnout from a therapist, but it also branches over to primary care and whatnot. So just keeping the providers in the workforce for healthcare and not having them look other places.
I've been in medtech for 23 years now. I do a lot of work in FQHC and tribal health. So honestly, what concerns me the most is not only physician retention, but these FQHC and rural health and underserved and underprivileged communities being able to recruit specialists, right? So this is a primary care convention. We have no problem finding primary care providers. trying to find an OB-GYN or cardiologist or oncologist to go to Salida, Colorado in the middle of nowhere, Rio Grande. I just see it a lot, and it's a big concern of mine that these FQHCs and CHCs are at disadvantage to recruit the specialists. So these children and patients and a child without cancer, let's just say, is having to drive 400 miles for specialty care. That's what concerns me.
I think healthcare at times is getting away from putting patients first, and I'm really interested to see how technology is going to change over time to get rid of maybe some of like the legacy technology, which is limited putting patients first. I think we just really need to get back to putting patients first, and I think a lot of the new technology out there is helping to do that and just get rid of a lot of the administrative burden and things like that.
Well, I found as I've toured across the U.S. that a lot of organizations are wondering when the security rules actually going to release instead of being on hiatus and wondering what everyone needs to budget for.
That makes sense. What about you?
Yeah, same thing. Like, will we be required to do like a network vulnerability test? Will we be required to do pen testing? It's for budget constraints. We need to know this.
I think it's probably going to be a hot topic for a lot of people, but I think just AI and like how it can make clinics, doctors, everything more efficient. So like getting AI scribes for doctors. We heard a lady today talk about like grant writing for hospitals and community health centers. So I think that's going to be a big trend probably for a lot of people.
What is a trend in healthcare right now that you are interested in and something you're excited about, looking forward to, anything like that?
Well, so as you know, healthcare is pretty awful right now. It's systemically broken. But I think one thing we're realizing is that there's always hope. And with the problems and the challenges that we're seeing, there's layoffs that come with it. And so what we've been able to do is quantify the value of nursing through return on investment and looking at every single one of those interventions that they're doing. Even Jen's program, what's the return on investment? What's the value of nursing? Because so often we're saying nurses are an expense. They're a labor expense, and we should cut them. And it's unfortunate. And so when you start to quantify what they're doing, it changes the narrative, and they become so valuable, and we shouldn't cut them. So that's my hope. I see it trending quite a bit. There's a call of action from AACN to really focus on that return on investment and the value of nursing.
One of the trends in healthcare is I'm obviously interested in digital and prescription therapeutics, and one of the aspects that I'm very excited about is we work with somebody here locally, our data scientists. We've developed a predictive algorithm that uses structured data and how much they drink to predict for clinicians whether somebody is making progress or not, so they can look and get a quick summary. And what I'm most excited about, we're also developing methods to use the same model to do short-term and long-term predictions and incorporate other research, so stay tuned, because we're going to try to work and help people that are liver transplant patients stay on the list.
One of the trends that I would say that I'm interested in really seeing how it's kind of progressing is the trend from where we've gone from really invasive procedures to more or less invasive procedures, and we're seeing just more access to different tests and different ways to screen people for any diseases or cancers in very minimally invasive ways. So it's just making it much more convenient for patients and much more accessible for people to obtain their regular health screenings in much easier ways, which I think is fantastic.